Our final question today is from Chandra. She's asking, what is your recommendation to improve our APP quality scores?
Great question, Chandra. And I think it's particularly important now that we're in that changeover from the web interface to the the full APP. So, the one thing I'd suggest you do is switch as soon as you can from web interface to MIPS CQMs. And in a previous week, I answered the question of why MIPS CQMs. And I still remind you that I think that's your best option, gives you the most freedom and the potentially the highest scores. It's not too late to engage your registry right now to submit MIPS CQMs to satisfy the APP for 2022. In fact, at Mingle Health, we will be accepting clients right through the 1st of January or maybe even longer. Now, you might choose to do a simultaneous web interface submission with a MIPS CQM submission or an eCQM if you choose to go that way. But I would put that investment of time, money, and effort to a different use. And let me explain. By engaging now, you can do a preliminary run of your 2022 data on the first 3 quarters of 2022. Then I suggest you audit your results. The registry you engage should be able to give you a list of specific patients in each denominator with their met, not met, or excluded statuses. I'd suggest you audit about 30 of those patients as a minimum as a preliminary check of the data accuracy. This will be the first of many steps to steadily improve the accuracy of your measurement. In fact, I'd suggest that improving the accuracy of your measurement is now a continuous, lifelong improvement process. In the final processing of the entire year of data, I suggest you take a list of all of your denominator patients that fail each measure and manually check the chart. It's appropriate for your registry to add your manually extracted data to the submission to improve your scores. Now, an ECQM can only take the properly documented electronic data that's in the submission, but it's entirely appropriate to do a manual abstraction of your charts and correct any missing data in your final submission, so you can get the best score possible. So drawing from all patients and all payers, there's a lot of patients eligible to each measure, but you'll only have to do 3 measures, and you'll only need to abstract the failed patients, and all it can do then is improve your score. As you audit, try to determine the reasons that performance met data was not detected in the electronic data set, so you can go back and correct your templates that aren't capturing the data correctly, or provide supplemental training for your users so that they know where to record the data, that it's easily accessible. You'll find that your scores depend on clinical performance, of course, but it also depends on the proper documentation workflows and effective data exchange. So the nature of the extraction queries and the logic that grades the electronic data. So these three factors you'll be upgrading every year for an improvement in your scores. So start now. Do your first couple of rounds of improvement while you enjoy a relaxed quality standard for those using the CQMs before the web interface finally sunsets. Don't wait till the last minute. So thanks, Chandra. Great question, and good luck with your changeover.